Hi all, I am Dr. Manoj Ayyappath. I am a surgeon from Kerala, India. Welcome to my channel. Today I am going to talk to you about a disease which causes severe pain in the anus, or a painful anus, one of the causes of painful anus. One of the most important causes of painful anus is fissure in ano. What exactly is fissure in ano? It is nothing but a small wound or tear in your sphincter. Sphincter is the muscle which closes the anal opening. So if you have a tear there, it causes severe pain. The cause of pain is not due to the tear itself. It is due to the muscle spasm after that tear. So what are the presentations? Patient will have severe pain after defecation, and even after defecation at the normal resting time also patient will have severe pain. There will be bleeding. It will not be very much bleeding, but it will be fresh bleeding, mostly after defecation. Sometimes even otherwise also patient can have bleeding. Other symptoms are rare. These two are the predominant symptoms. This happens in general with females more than males. It is associated with hard stools and constipation. Also in patients after delivery. So postpartum fissure is very common. So the fissure is basically two types: acute fissure and chronic fissure. Acute fissure is within 1.5 months. The first episode, the tear episode happens, and the duration of that illness, if it is less than 1.5 months, it is an acute fissure. If it is more than that, then more than 6 weeks, you term it as a chronic fissure. So what exactly you should do when you have a painful defecation? So when you have a painful defecation, you meet a surgeon as soon as possible. The surgeon will examine you. So that is very important. A thorough examination by the surgeon itself can reveal the diagnosis. You just need to spread the buttocks and see the hole. You can see the tear there, and with small evidence of bleed, you will have a small skin protruding outside. A small skin, that is skin tag. It is the scar of the fissure. So when there is a skin tag, it's mostly chronic fissure. So once you have diagnosed it, then what you can do? So after the fissure, the treatment is of two types. For acute fissure is one in a methodology, and chronic fissure is different methodology. Acute fissure generally responds to painkillers. So you give painkillers, you give stool softness. You should not give so much stool softness, but the stool softness should be bulk forming stool softness, bulk forming laxative, so that the stool itself will slowly dilate the sphincter and reduce the spasm. So the painkillers, stool softness, and giving sitz bath, and topical application of ointments, that is anesthetic jellies, anesthetic ointments. There are various ointments available in the market. So you apply that, and the treatment should be at least minimum 3 weeks. The best is to 6 weeks to 3 months for acute fissure. That will give you a cure of more than 80 to 90% in case of acute fissure. In case of a chronic fissure, the response rate to medicine is only 40%. So like if you treat 100 patients, only 40 patients can have cure, I say, but the patient may get relief from the pain and all. So the same methodology you can use. You give laxatives and bulk forming laxatives, you give topical ointments, sitz bath, many response. But a permanent cure in most of the patients, especially the modern lifestyle and the food we eat, which contains less vegetables, more of meat and all, in such conditions the response rate will be very less. But anyways, you can try at least for 3 months. You try for conservative management, but if the patient is not responding or the patient is having severe pain, then you have to proceed with surgery. Even for acute fissure which is not responding to medical treatment, then you have to proceed for surgery. So what is a surgery? Previously they used to dilate the sphincter. They put 2 or 3 fingers inside and you dilate the sphincter. Nowadays it is not done. Maximum anal dilatation is not done. Reason is, if you dilate, later on you will have incontinence. You cannot hold on the fecal matter. Presently now they do lateral anal sphincterotomy. That is a small surgery, very small surgery, in which you give a small cut on your anal muscle so that the pressure in the anal muscle is reduced a bit, so that and then the blood supply to the fissure wound increases. That's how the fissure heals. So that's a fantastic surgery. The only problem with such surgery is, like, if you don't do it carefully and you cut without any control, then you can have incontinence. So an experienced surgeon should do such surgeries. And maybe you will have bleeding for 2-3 days, mild bleeding, and pain for 3-4 days may be there, and some wound discharge. These are the general complications, common complications of a fissure surgery. Other complications, incontinence, are rare. And how can you make this wound? You can make this wound by cutting using a knife, or you can use cautery, that's a special current you use, or you can use laser. Whatever it might be, even after laser, you can have pain for 3-4 days. The reason is very simple. The sphincter, the muscle need to dilate and close, then only the motion will pass. So after passing motion, you may have pain even after surgery for few days. When 3-4 days after that, you will not have pain. And many patients ask me whether the fissure comes back again or not. No, the response rate, the results of lateral sphincterotomy is very good. It is more than 90 to 95% complete cure rate after lateral sphincterotomy, and it is generally a daycare procedure. Come in the evening, you finish surgery, and by evening, come in the morning, you finish surgery, by evening and go. Such easy surgery it is. So that's what about chronic fissure or painful defecation. And thank you for watching my video, and I may request you to send the link of this video to your friends, and please subscribe my channel for getting the new videos. Thanks once again. Thank you.